feel as though the observed results that you saw in your study align with what has been seen in other clinical trials previously with Ubrogepant?
Yeah, thank you. As you point out, so currently we have the preliminary results for this medication, Ubrogepant, and the Achieve-1 and Achieve-2 trials were the major phase 3 randomized controlled trials that were done that established the safety and efficacy of Ubrogepant. So to tell you the result, to share with you the result of the studies from the clinical trials, about 20% of patients experience freedom from headache pain, which means that they had a moderate to severe pain, and that went from severe pain to zero pain 2 hours after they take Ubrogepant. And the data, again, was obtained from one attack. In terms of patients who have obtained pain relief at 2 hours, which means that Ubrogepant was able to bring the pain from moderate to severe pain to mild pain, was achieved in 61% of the study population. In our own study currently, from our preliminary results, about 32% of patients have experienced headache freedom at 2 hours after taking Ubrogepant for one or more of their attacks. And up to actually 73% of patients had experienced pain relief at 2 hours after they took Ubrogepant for at least one attack. Additionally, consistent relief of pain for all treated attacks was experienced by 27% of patients. So I think those are very encouraging results and align quite well with the results from the Achieve-1 and Achieve-2 trials, especially that we are capturing the responses of multiple attacks and conducting the study in a population who had multiple ineffective prior treatment trials. So for example, in our population, on average, they have previously tried and failed either intolerance or didn't have in fact 5 acute treatments in the past, and on average they have tried and failed 3 treatments in the past. So I think the efficacy results align quite well. As far as the adverse event rates from the Achieve-1 and Achieve-2 clinical trials, nausea, somnolence, dry mouth, and dizziness were the most commonly experienced adverse event that happened anywhere between 1.7% to about 4% in the clinical trial population. However, from our data, the adverse event rate appears to be much higher. In fact, that fatigue was experienced in 22% in our population, nausea 7%, dry mouth 7%, and constipation 2%. So I believe this could be resulted from the fact that we have currently like a small number of patients. The data are from 57 responses that we have so far, but we are still actively collecting data, and that our population, they had previous kind of intolerance or no responses to previous treatment trials. So I think that might play a role as well, but we will kind of definitely give you an update once we have more information.